Today I'm going to discuss how to perform a trigger finger injection. Let's start with the indications. Trigger fingers occur when a flexor tendon nodule repetitively gets stuck under the annular pulley on the palmar aspect of the finger. Injections are indicated once conservative therapy, which includes activity modification, splinting, and NSAIDs, has failed. In a recent Cochrane review, two randomized controlled studies comparing injections of lidocaine and cortisone with lidocaine alone showed that cortisone injections were more effective at 4 weeks. The number needed to treat was 3. We will now review the finger anatomy. The flexor tendon is responsible for flexing the finger. The tendon is kept in place by multiple fibrous pulleys along the volar aspect of the finger. Thickening or nodule formation occurs in the flexor tendon, which catches on the A1 proximal pulley, making finger extension difficult. The following diagrams demonstrate how the nodule in the flexor tendon catches on the pulley. A trigger finger can occur in any finger, but is most commonly seen in the ring or fourth finger. To inject a trigger finger, you will need gloves, and alcohol swabs and betadine or chlorhexidine to disinfect the skin. A 3 milliliter syringe with a 25 gauge 5/8 or 1-inch needle is used for the injection. You will draw up 1/2 milliliter of 40 milligrams per milliliter Kenalog, so 20 milligrams, or its equivalent, with 1/2 milliliter of 1% lidocaine. Other supplies include ethyl chloride to anesthetize the skin, and gauze and a Band-Aid to stop the bleeding after removing the needle. The trigger finger can be injected in 2 different ways. You can inject right at the tender nodule or at the proximal interphalangeal digital crease and angle towards the nodule. Mark the injection site with the cap of a pen. Clean the skin with an alcohol pad and a chlorhexidine swab or 3 betadine swabs. You should allow the chlorhexidine or betadine to completely dry before proceeding with the procedure. Spray the ethyl chloride on the skin overlying your mark until the skin turns white. The needle is inserted into the flexor tendon nodule at a 45-degree angle. When you feel rubbery resistance, you are at the level of the tendon. Back the needle out slowly until it is no longer in the tendon and the fluid flows easily within the tendon sheath. Never inject under pressure. Steroid injected directly into a tendon may cause tendon rupture. Remove the needle and apply pressure with the gauze until any bleeding has stopped. Gently massage the fluid up and down along the tendon sheath. Then apply a Band-Aid. Alternatively, you can perform the procedure by inserting the needle at the proximal interphalangeal digital crease and injecting along the tendon sheath. Notice how the needle is backed up slowly just until it exits the tendon and the fluid flows freely. It is in this location within the tendon sheath, but outside of the tendon itself, where the medication is injected. Instruct the patient that the finger may be numb for several hours after the procedure and that pain may be present for several days. Instruct the patient that the cortisone usually takes 72 hours to take effect. Using a finger splint after the injection for 1 to 2 weeks can increase the efficacy of the injection. This is an example of a soft Velcro splint that can be given to the patient. After 3 days, advise the patient to start finger extension exercises. To do this, have the patient stretch and hold his finger in extension with the other hand for 10 seconds, repeating 10 times to make a set. Recommend 3 sets daily. The patient should avoid repetitive gripping and use padded gloves for any vibrating tools, for example, jackhammers. Instruct the patient to return to your office if they develop redness, swelling, or increased pain at the injection site. The ICD-9 and CPT codes that you would need to document the procedure for the visit encounter are listed. This is a summary slide showing the needed supplies. This is a summary slide describing the technique for a trigger finger injection.